The Delta will become a problem for the unvaccinated individuals, and unfortunately, because they get it, the vaccine will not prevent you from not getting it, but if you do get it, your body's been trained with the right antibody response to really give you a mild form of it. And what we worry about is if you have vaccines and you got people under the age of 12, yeah, if you get sick, you may give it to them. And I'm saying, again, we've vaccinated hundreds of millions of people, and the problem that we have is we have a mortality or death rate in this country of 610,000 people. We forgot that. And 34.8 million people have gotten COVID. Again, the numbers just don't resonate with people, and I think it's real important for us to vaccinate if we want to prevent this mutation from continuing, because it's growing in that percentage, and we have to get to 80%. 80% of the people have to be vaccinated. In this state, we're still not there, because that 20% will continue to have this virus mutate, and it'll make the actual vaccine less effective going forward. So it's real important that if you don't know, ask someone that may give you the right information. The vaccine is safe.
I'm Peter Wilson. I'm the supervisor at Seneca Strong, which is a department within the Seneca Nation Health System. We are under the Wellness Center in Cattaraugus, and we have our own little building out in Allegheny. We are partnered with BHU, which is mental health counseling and addiction counseling. We work with Child and Family Services, which is a Seneca Nation service that we try to utilize before CPS is called. We have a prevention team that goes into the schools. We also have a medical social worker team that we can refer any of our individuals to for any assistance with that. We are a peer-driven group that works with any individual with an alcohol or drug addiction problem. The uniqueness that the peers bring to the table is that they've got the lived experiences. So they understand the cravings, they understand what an individual is going through at the time of when they're needing the help. We're not a go grab you off the bar stool kind of an organization. We're there to help you, meet you on your path, and walk with you on your journey to get you where you want to be. Seneca Strong supports all avenues. We do AA, NA, but we also use our holistic and our cultural components as well to help individuals along the way. Years and years ago, I was a fence installer. I started in Buffalo, and I worked with the Urban Medical Clinic, Dr. Vazquez. He started a clinic on Niagara Street, and I was the fence installer there. And one of the things that I found very unique, and which almost drove me forward to where I'm at now, was the fact that he saw a community that needed a medical center, needed a clinic, and he took it upon himself to start that clinic. And it always stuck with me that he did that much for his community. And when I moved here to Salamanca and the Seneca Nation territory there, that was one of the things that drove me forward, was remembering how much one man made a difference in a small community. So that's something that keeps me going forward today with that, is like, I want to give back to the community. We want to make sure that, you know, our next generation has something to look forward to.
Hi, I'm Joyce Seneca. I'm on the board of the Motion Project Foundation, and I'm excited to say we're open. We have a new facility that's located on Genesee Street. It's called Motion Project Foundation, and it's a new gym for people that have paralysis. And it would never have happened if it wasn't for our founder, Natalie Barnhart. She has worked diligently for us to not only be able to give out grants for people that have any kind of paralysis, but mostly spinal cord injuries. But now we actually have a facility that people can actually go there and work out and take advantage of all of our equipment. Right now, we actually have the Locomat, which is actually the robotic machinery that actually can put you on there, and if you're in a wheelchair, can get you up and walking, and it uses the robotic systems and a lot of technology that I don't even understand, but it's amazing. Not only that, but we have about 17 new pieces of equipment that is just dedicated to people that have paralysis. So when you wanted to go to a gym before and you are in a wheelchair, you can't go because they don't have the equipment to be able to hoist you up, to be able to get you to exercise. We have everything available for you. So if you end up coming to us, we have exercise specialists that are trained, the master's degree, and they're able to take care of you and evaluate you and put you on whatever equipment you need to get going.